What if I told you that something you do every single day without even thinking about it could be slowly enlarging your prostate and setting you up for years of bathroom troubles, sleepless nights, and that burning urgency that hits you at the worst possible moments? And what if this habit is so common that 90% of men over 50 are doing it right now, completely unaware of the damage they're causing to their most sensitive gland? Have you ever felt embarrassed leaving a movie theater 3 times during one film? Or experience that frustrating trickle that feels like your body is betraying you, even though you feel like you still need to go? If you're nodding your head, you're about to discover why this is happening and how to stop it. I'm about to reveal the shocking habit that's destroying your prostate, and it's probably something you did last night. But first, let me ask you to rate your sleep quality from 1 to 10 right now. If it's below a 7, keep watching because this could change everything. Have you noticed that you're waking up more often at night to use the bathroom? Or maybe you've experienced that frustrating feeling where you think you're done urinating, but then you have to go again just minutes later. If you've experienced this, comment yes below. You're definitely not alone. Dr. Michael Rodriguez from UCLA Medical Center told me something that shocked me. Most men think their prostate problems are causing their sleep issues, but we're discovering it's often the other way around. These aren't just normal signs of aging like your doctor might have told you. They're warning signals that your prostate is under attack. The habit I'm talking about is chronic sleep deprivation and poor sleep quality. Yes, you heard that right. But before you dismiss this as too simple, let me share what Robert, age 58, discovered. He went from waking up 4 times per night to sleeping through the night in just 6 weeks by fixing this one thing. His urologist was amazed when his prostate symptoms virtually disappeared. Now here's where it gets really concerning. When you don't get adequate quality sleep, your body produces more cortisol, the stress hormone. This creates a cascade of inflammatory responses that directly target your prostate tissue, causing it to swell like a balloon being slowly inflated night after night. But there's one sleep mistake that makes this 10 times worse, and I'll reveal that in just a moment. Here's what most doctors won't tell you. Poor sleep disrupts your body's production of melatonin, a powerful antioxidant that protects your prostate cells. A groundbreaking 2023 study from Johns Hopkins found that men with lower melatonin levels were 340% more likely to experience prostate enlargement. But wait, it gets worse. Sleep deprivation also affects your insulin sensitivity, and insulin acts as a growth factor for prostate cells. Dr. Sarah Chen from Harvard Medical School states, "We're seeing a direct correlation between sleep quality and prostate size that's stronger than we ever imagined. During deep sleep, your body produces 70% of its daily testosterone. When you don't get enough deep sleep, testosterone plummets while estrogen levels spike. This hormonal chaos creates the perfect storm for prostate growth." Now here's that sleep mistake I mentioned, and this one will shock you. The biggest mistake men make is drinking fluids right before bed to stay hydrated. This creates a vicious cycle. You wake up to urinate, which disrupts your deep sleep, which lowers testosterone and increases inflammation, which enlarges your prostate, which makes you wake up even more often. Think about your own sleep patterns. Are you getting 7 to 8 hours of quality sleep each night? Do you find yourself tossing and turning, waking up multiple times, or feeling exhausted even after a full night in bed? Here's the shocking truth. A 2024 study published in the Journal of Urology found that men who consistently got less than 6 hours of sleep had prostates that were 45% larger than men who got 7 to 8 hours of quality sleep. This is just the beginning. Wait until you hear about the solution that's helping thousands of men reclaim their nights. Breaking this cycle requires targeting both sleep quality and prostate health simultaneously, and the results can be dramatic. Let me share the exact protocol that helped James, a 62-year-old engineer, go from waking up 5 times per night to sleeping peacefully through the night in just 8 weeks. His wife said it saved their marriage because they were both finally getting rest. Stop all fluid intake 2 hours before bedtime. This single change can reduce nighttime bathroom trips by up to 60% within the first week. Keep your room between 65 to 68 degrees Fahrenheit. Martinez from the Sleep Foundation explains, cool temperatures naturally boost melatonin production, which directly protects prostate cells from inflammation. Avoid screens for 1 hour before bed. Blue light suppresses melatonin by up to 85%, leaving your prostate vulnerable to oxidative damage all night long. But before I share the most powerful part of this protocol, you need to understand something crucial. Here's what transforms everything: specific nutrients that work while you sleep to restore hormonal balance and reduce prostate inflammation. Magnesium, 400 milligrams taken 1 hour before bed, promotes deep sleep while reducing prostate inflammation. Dr. Thompson from Mayo Clinic notes, magnesium deficiency is found in 78% of men with enlarged prostates. Zinc, 15 milligrams with dinner, supports both sleep quality and prostate health. Men with adequate zinc levels have 40% smaller prostates on average. But there's one sleep position that can reduce prostate pressure by 30% overnight. Sleep on your side with a pillow between your knees. This reduces pressure on your pelvic area and improves circulation to the prostate. Avoid sleeping on your stomach. It compresses the prostate and can worsen symptoms. Margaret Wilson, whose husband Tom suffered for years, told me within 2 weeks of changing his sleep position and following this protocol, Tom stopped getting up at night. I got my husband back. Here's something that will surprise you. Men who exercise regularly but within 3 hours of bedtime actually have worse prostate symptoms. Exercise earlier in the day improves circulation and reduces inflammation, but late exercise elevates cortisol when you need it lowest. A 2023 study from Stanford showed that men who exercised in the morning had 25% better sleep quality and 35% fewer prostate symptoms compared to evening exercisers. Dr. Patricia Adams from Mount Sinai has tracked over 500 men using this sleep optimization approach. She reports, we're seeing 70% of patients experience significant improvement in urinary symptoms within 6 to 8 weeks. The men who are most consistent with the sleep protocol see the best results. David, age 67, shared, I was scheduled for prostate surgery, but my urologist said to try this first. 6 months later, my prostate had shrunk enough that surgery was no longer needed. My quality of life is completely different. If you're experiencing blood in your urine, severe pain, or complete inability to urinate, see a doctor immediately. This protocol supports prostate health, but isn't a replacement for medical care when serious symptoms are present. For PSA levels above 4.0 or family history of prostate cancer, work with your urologist while implementing these sleep improvements. Many doctors are now recognizing sleep quality as a crucial factor in prostate health. Your prostate health is intimately connected to your sleep quality. By optimizing your sleep, you're not just supporting your prostate, you're boosting your immune system, improving cardiovascular health, and increasing energy levels. Remember, everything affects everything else in your body. The men who see the best results are those who implement these changes consistently, not just when they remember. Don't let another night of poor sleep contribute to your prostate problems. Start with just one change tonight. Stop drinking fluids 2 hours before bed. Your prostate will thank you, and your partner will too when you stop disrupting their sleep with constant bathroom trips. Here's what I want you to do right now. Choose one change from this video to implement tonight. Will it be the 2-hour fluid rule, the bedroom temperature adjustment, or the new sleep position? Comment below with your choice. I read every comment and often respond with personalized tips. If this information opened your eyes like it did for thousands of other men, hit that subscribe button and ring the notification bell. Next week, I'm revealing the 5 foods that can naturally shrink your prostate while you sleep. You won't want to miss it. Remember, the best time to start taking care of your prostate health is right now, before problems become severe. Sweet dreams, and here's to your healthier prostate.